Hey, Central Georgia family, this is Dr. Davis. We have a different way of performing chiropractic here, and a lot of people have questions of what is that gun? What is that thing that you use? How is this different? And it really starts with the priority. If you focus on the area that has the most impact of the entire nervous system, and you correct that area or get the stress off of it, the rest will follow. Now, that's not to say that's the only place that we ever adjust or the only place that's of any concern, but it's the most important. And it's called the atlas. It's the top bone of the spine. It's located right here, millimeters from your brain stem. So if this top bone named the atlas is, for say, out of place or out of position, it puts stress on your nervous system. Stress from here all the way down. Now, some chiropractic offices, they will adjust many segments, many ways, many different times on every visit. I'm not here to negate one versus the other. I've been adjusted that way, and it had helped me at a season in my life, but I still had problems with more mental clarity, focus, and retention of the education or the years of school that I was in. And Upper Cervical is the only brand of chiropractic or the only type of technique that was able for me to clear my mind, to sit down, to be able to read and study. It didn't matter how many people were in the room, where I once had to be isolated, read by myself, nobody interrupt me, to where I could read and study in a room full of anybody. It also helped me with energy levels. I was chronically fatigued, always tired, and nowadays I'm grateful for Upper Cervical and all the things I get to do. If I didn't have the energy levels up, I would not be able to do what I do today. That was my journey through Upper Cervical. But to put it to you in another way, adjusting the whole spine is kind of like a shotgun approach. Many different facets adjusted on one visit, whereas what we're considered to just the atlas is more or less precision, focusing almost like a rifle or a sniper, focusing on one accurate target to make sure that that is driven home and that the most important area of the spine is free and clear of stress, of nervous tension, of inflammation. And once that happens, that's where we see a major turnaround with everything below. Because you have to think, if your head and neck are off here and I adjust your lower back, I can have this perfect. But if my head and neck are off, well, the rest is going to follow. So until I get this in the midline, which is necessary, now the rest can begin to heal. So generally speaking, this is more the primary issue, and there are secondary issues. Let's all face it. I've been carried into a chiropractor's office before because I had a lower back injury and I lost power to my legs. I was adjusted and walked out. So I've lived this, and I'm here to have a different way, a different brain, and that is why we can treat newborns. That is why we can treat patients that are up to 95 years old, give or take. That was our oldest patient, and have the same effect because it's accurate, it's precise, and it's driven with image-guided technology from X-ray, and we also use other scans as well to hone in to make sure we are precise and know exactly where to go. So with this, we also just are celebrating at the office, just overcame the specialty program. DCCJP is what it's called, or deformate and craniocervical junction procedures, meaning I've learned about all the procedures to adjust here. There are several. We choose one, which is orthospinology. There are others, but we've chosen orthospinology, and that's primarily what we use in our office. So when it comes to it, it's fascinating. A lot of doctors are here focusing on the brain or the neck, but nobody's looking in between. Now that we're making that connection of what we can do and how we can help, and we can show before and after with exact imaging, doctors are willing and open to work with us. Neurologists, neurosurgeons, MDs all across the board, because they at times run out of options for these patients and they don't know what else to do. Most common issues we see with upper cervical misalignments would be headaches, neck pain, it'll be dizziness, blurred vision, nausea, brain fog, or difficulty concentrating. Those are some of the top ones. And generally speaking, at some point in life, you had a wreck, you had an accident, you had something that jarred your neck. It could have even come from birth that has caused it to be out of alignment. You would never know unless you had it evaluated to see where you're at. But once that is evaluated and cleared, life gets better, your health will get better, things happen better. And that's why we're here for you guys. We're here practicing upper cervical care and yes, treating pediatrics in all ages of life, but we're excited, we're happy to offer this unique performance of chiropractic to you. And if you have any questions or think, hey, maybe that's a resolution to my issues, feel free to reach out to us, contact us, call us, leave a text or leave an email. We'll reach out to you and see if we're a match to help you with your needs. Take care. I'm Dr. Davis. God bless.